Hello, Brock here. Going to be doing my health assessment of you. What's your name?
Aaron Ramsey.
And what brings you in, Aaron?
I just have a really bad headache.
Oh, yeah. When did this start?
About a week ago.
And where does it hurt exactly?
It's right in my forehead.
And how long does the pain last?
It's persistent.
Can you kind of describe what the pain feels like?
It's like an ache, and it feels like there's just someone squeezing.
Gotcha. Anything make it worse?
No, I just have had a hard time sleeping and going to work.
Oh, I understand. So I guess and if you had to rate it, what would you say? 10 being the worst, 0 being none. How bad is it?
10.
10. Any associated symptoms?
Not really, but I have had some abdominal pain over the last 4 months or so.
Really? Tell me about this abdominal pain.
So it's in my lower abdomen. It's intermittent. It just kind of comes and goes. It's typically relieved with a heating pack.
Okay. And if you had to rate it, what would you say?
At the time when it happens, it's about 8.
Okay. And then when did it start?
About 4 months ago?
And it was just like an aching pain?
Yes.
And then you said it just kind of relieved with the heat pad.
Mm-hmm.
Okay. Can you tell me about your medical history?
I have hypertension, hyperlipidemia, seasonal allergies, anxiety, and arthritis.
Gotcha. Any history of seizures or falls?
No.
Okay. And then the hypertension and hyperlipidemia, when were you diagnosed with that?
When I was 40.
40? Okay. And are you on treatment?
Yes.
Any complications with that?
No.
And then what's your surgical history?
Tonsillectomy when I was 8 and a knee replacement 3 years ago.
Any issues with your recent knee? Did you have any problems with anesthesia?
No.
No. Are you able to walk without a cane or a walker or anything? Good. Are you any history of any pregnancy or any children?
No.
No. Okay. When was your last menstrual cycle?
It's been over 10 years.
Do you have any mental health conditions diagnosed?
No.
Are you up to date on your flu, COVID, and pneumonia vaccines?
Yes.
Have you received any recent screenings? Have you ever had a colonoscopy? Have you had a pap smear?
Last pap smear was 3 years ago, but I have not gotten a colonoscopy yet. I've just been busy.
Okay. Any significant childhood illnesses?
No.
Okay. What medications are you taking now in dosage and frequency?
I take lisinopril 20 milligrams once daily in the morning and Lipitor 20 milligrams daily once at night.
Gotcha. Any over-the-counter meds that you take or any remedy meds?
Just ibuprofen.
Okay. Just kind of as needed for...
Yeah, for my knee, for the abdominal pain.
When was your last dose of your other medicines, your scheduled meds?
Lisinopril was this morning and Lipitor last night.
And you're compliant with those medications?
Yes.
And you follow up with do you have a PCP?
Yes.
Okay. Any allergies?
No allergies.
And what about your family history?
My mom has rheumatoid arthritis and migraines. My dad has hypertension and diabetes.
And when were they diagnosed with those?
My mom was 35, my dad was 40.
Gotcha. Are they still with us?
Yes.
Any complications? Okay, gotcha. And then are you working?
I'm a nurse.
Are you married?
I am.
And you live at home with
Yes.
you? Okay. Do you feel safe at home?
Yes.
Any drug, any alcohol, or any tobacco use?
No.
Okay. Do you have an advance directive?
I do.
Gotcha. Okay, let's kind of just review your system. So, have you had any recent appetite or any weight change, any fatigue, any weakness, any fevers?
Actually, I have. I've had some weight loss over the last probably 3 months or so. I've lost about 20 pounds. But my appetite has been fine. And then just a little bit of fatigue probably the last 3 months when the weight loss started.
Has it affected your activities of daily living? Okay.
No.
All right. Any headaches? So you did complain of the headaches. Any head injury, any neck pain or stiffness, any swollen glands or dizziness?
No.
Any vision changes, any nasal congestion, any nosebleeds, any eye pain,
No.
any sore throat? No. Any skin issues, any rash, lumps, lesions, bumps? What about chest? Any palpitations, any chest pain?
No.
Have you had any shortness of breath, any difficulty breathing laying down? Have you been coughing anything up?
No.
No. Any GI issues? I guess you said you've had some weight loss. Any diarrhea, any nausea or vomiting?
No.
Any blood in your stool?
No.
Okay. Urinary, have you had any issues with that? Any frequency, any urgency, any hesitancy?
No.
Okay. Have you had any muscle or joint pain, any joint stiffness?
No.
Any
Uh-uh.
numbness, tingling, any seizures?
No.
Any memory changes, any depression?
No.
Okay. What about any heat or cold intolerances, any excessive sweating? Have you been bruising easily or bleeding easily?
No.
No.
I do have a little bit of right knee pain, but I usually just take the ibuprofen. At
Sure.
home.
Well, let me go ahead and do a focus assessment. So they did provide our vitals for you, Aaron. So 152 over 94, 86 heart rate, 18 respirations, 99% sat on room air, and then 98.4 temperature. You do appear fairly uncomfortable, I guess. You know, was it from the head pain? You were kind of grimacing earlier. And then hygiene looks to be appropriate. So we'll start with just a neuro assessment, kind of check in. Can you tell me your name, date of birth, where we are, and then a current event, maybe who our president is, just to kind of check your orientation?
Aaron Ramsey, April 21st, 1973. We're at the clinic right now, and Donald Trump's president.
Good, good. So I'd like to check your cranial nerves. For the video's purposes, I'll just do your 3, 4, and 6, checking your eyes to be able to track the fields as well as check them for a pupillary response. So if you would just follow my pen, keep your head still, follow these fields. Good, making sure you can follow into all fields, not having any gaze preference or anything. Good, looking good. All right, and then I will check you with my light as well, checking your pupillary response. Good, pupils are both equally round and reactive to light and accommodation. You're not having any vision changes, are you? Okay, you don't feel dizzy or anything, can you smile? Good, and then raise your eyebrows. Good, and then just gonna check your sensation. If you would close your eyes. Does this feel the same on each side?
Yes.
All right, good, good. And now we can check your strength. If you'll just go palms to the sky for about a 5 count, that looks good. And then arms right here, kind of chest and push against me. Pull towards you. We'll check your legs as well. Push against me. Kind of push against me. Excellent. Can you just walk for a second? I just want to check your gait. Make sure you're not having any unsteadiness. Good. Good. And if you'd have a seat again, we'll kind of check your coordination briefly. If you would just reach out, touch my fingers, and then touch your nose twice, and then do it with your left arm. Good. Very good. Okay, kind of moving down. I know you had said the headache, so if I could just examine your head a little bit. All right. Is it kind of tender?
Yeah.
I don't see any open areas. I don't feel any masses. I don't feel any lesions. As far as kind of following down, short and long-term memory seems to be intact. I guess now we can take a look at your heart. So if you would, just let me look at your neck. I don't see any JVD. I'm going to take a look at your carotids. No bruits. And then now I'm going to go ahead and just inspect your chest, and then I'll listen to your heart sounds, okay? Just going to feel your chest here. Tell me if you have any pain. No? I'm just going to feel for your apical pulse here. Good, good. And now let me listen to your heart sounds, okay? Listening to your aortic, get your pulmonic, your herbs, and then down to tricuspid, and then down to your mitral valve. Not hearing any abnormal heart sounds. S1 and S2 are intact. No murmurs. Now if you could just let me further check your circulation. I will check your pulses. Good, good. Radial pulses are both palpable. Capillary flow less than 2. Nice and red. Nice and warm. DP pulses are +2. Feet are nice and warm and pink. Capillary flow is less than 2 seconds. Can you just press that on my hands like a gas pedal and then pull up towards your chin? Are you having any pain in your calves?
No.
I don't see any edema. I don't see any swelling. No open areas, no lesions, no ulcers, so that's great. I guess further, let me look at your lungs. So we'll take a listen to those. You're not short of breath now, are you?
No.
Good deep breaths for me. Okay, we'll start here at the top and then work our way to the bases, listening through all lung fields. Not hearing any adventitious breath sounds. Lungs sound clear. Listening to your bases here. And I also want to listen on your backside as well. Symmetrical chest rise. No accessory muscle use. Lung sounds clear. I don't hear any crackles, any wheezing. Sound pretty clear. So further down, working, I guess we can take a look at your abdominal. So you did say you had the cramping some, or you having any belly pain right now?
No.
Okay, so I'm just going to visually inspect before I do anything. So I don't see any masses, no distension. When was your last bowel movement?
Yesterday.
Yesterday, okay. And then you've been passing gas?
Mm-hmm.
No appetite changes? Okay. So let me take a listen here, listening through all the appropriate quadrants. So we'll start here on the right lower. Good. Bowel sounds are all active in all 4 quadrants. Now if I could go ahead and palpate, just going to check for any mouse. If you have any tenderness, please let me know. Okay, I don't feel any masses. No tenderness, that doesn't hurt?
No.
Okay, no rebound tenderness? You're not really guarding or anything like that?
Not right now.
All right. That's okay. Go ahead and sit up for me. I think that concludes most of our assessment. I know we did have the headache that you had complained of. We're not claiming any abdominal pain right now. And so, yeah, thank you very much.